This is RTP180.
Thank you very much. We have about 500 patients right now that we treat at Southlight Healthcare for severe opioid use disorder diagnoses. And what that means is extreme addictions to prescription pain pills and heroin. So this is the type of phone call that we receive from individuals suffering from addiction and their families every week at Southlight. Historically, folks with addiction issues have gotten a pretty bad rap. This is largely because the symptoms of substance use disorders look like bad behavior. It's difficult for folks unfamiliar with the brain science of addiction to know that these behaviors don't indicate an inherent badness in an individual. We put such a premium on free will and choice in our country that it creates a confusing dynamic for what amounts to a brain disorder that negatively impacts the behavior. And like Dr. Knapp said, to make matters worse, there's a long and incestuous history of racism and in the way that we see individuals who use drugs. Already marginalized populations were blamed for the spread of drug use, despite this issue negatively impacting all races. The presence of mental illness also negatively impacts the population that we serve. So early childhood trauma, untreated depression, untreated anxiety, all negatively impact the folks that we work with. They increase the individual's likelihood of becoming addicted to substances, and they complicate the thought of any long-term recovery effort. And we know that the midbrain is responsible for the initiation of addiction. It's the survival part of our brain, and it handles the right here, right now, without us even thinking about it. So if an object enters our world before our frontal cortex has the ability to process it, the midbrain has the first crack at what to do with the object. So do we protect ourselves by killing? Do we eat the object out of hunger? Or do we dry hump a stuffed animal in the name of procreation? So the midbrain positions addiction. The midbrain positions addiction above everything else in the hierarchy of survival. So this explains why folks addicted to substances do such seemingly irrational things to procure and to use them. So folks much smarter than myself, like Dr. Nora Volko and Dr. George Koob from the Scripps Neuroscience Institute, have learned these developments over the past 10 years through massive advancements in the way that we're able to interpret brain imaging. So despite our current understanding of the issue, there were politicians put into place many years ago that began to treat addiction as if it was a criminal justice issue. And I'm talking about skyrocketing rates of incarceration due to the unprecedented expansion of the drug war. Treating the problem as a criminal justice issue instead of a public health catastrophe that it is hasn't worked. We're currently experiencing one of the highest incarceration rates in human history. Approximately 80% of our inmates have had a problem with substances. And these days, we know that an American dies every 16 minutes by overdose. That's about 90 deaths a day. And we know that 2017 was the second consecutive year where the number of Americans who died by overdose was higher than the number of American casualties throughout the entire Vietnam War. And despite our best efforts to train physicians and regulate prescribing practices, currently a quarter of all counties in the United States have more opioid prescriptions than people. And we know that opioids are so powerful that they change our brain chemistry. And it seems like a paradox, but there's a preponderance of evidence showing that the best way to treat severe opioid addictions is using opioids with medication-assisted treatment. And so how can that be? Buprenorphine and methadone, the two main opioid medications used in this modality of treatment, allow clients to stave off intense cravings and withdrawal symptoms. Simply put, this puts them in a position to have the ability to function without intoxication. So this means that they can re-engage in employment, act as fathers and mothers to their children, or start school and contribute to their community. That said, medication in and of itself isn't the answer. And we know that there's a sick irony in thinking that a pill is alone going to answer an addiction issue that often starts with a pill. And so I'll leave you with this point. Let's not make the same mistake that we've made over and over again in our society, attributing a person's behavior to their race, gender, or personality. We have a long and repeated history of being dead wrong. We're making the same mistake in our perception of folks who struggle with addiction. Thank you.